Hi, I'm Scott Green. I'm a plastic surgeon at the Plastic Surgery Center. This is Stacy Lassiter. She's our physician's assistant. She's important in all aspects of your surgical care, both pre-op and post-op. We're going to talk to you today about liposuction and lipostructure. Lipostructure is a newer term, and it really means in our industry being able to add tissue to a certain part to change the structure of a person's body. So liposuction came out in the 1980s, early 1980s. A physician named Ilius, French surgeon, came up with liposuction. And even though fatty tissue had been removed in circumstances long before then, he really came up with the way we do it today. The way we do it today is using very small cannulas or tubes. And a lot of you may or may not know what a millimeter is, actually how big that is, but the tubes we use are long, about 1 foot to 1.5 feet long, but they're only about 2 millimeters wide or in diameter. Now, I use tubes anywhere from about 1.7 millimeters all the way up to about 4 millimeters in diameter, depending on which area of the body we're doing liposuction. Liposuction, what it is using these tubes, or these cannulas as they're called, to remove fatty tissue from a certain part of the body. And we can remove fatty tissue from most any part of the body in the subcutaneous area. What does that mean? Subcutaneous means fatty tissue that's right underneath our skin. So for example, if somebody has a hip that sticks out on their thigh, or a flank area that's full, or sometimes even an area around their belly button that's looks a little fuller with fatty tissue, we can usually remove that. But there's fatty tissue that exists elsewhere in our body. So with that last part, like the tummy fatty tissue, sometimes tummy fatty tissue is in the subcutaneous plane, as I described, where it can be reached by liposuction. But sometimes it's inside, and we see a fair number of those patients, Stacy will tell you, when they come in for a tummy tuck or for liposuction, where that fatty tissue is what we call internal, or in this case in the tummy, visceral fatty tissue. There's other areas in our body where that fatty tissue may also be internal, in parts of our neck, even in our armpit or our chest. Even within our arms or our thighs, there's fatty tissue around different structures. Our vascular structures all have fatty tissue around them. And if there's a preponderance of fat inside, that fat we can't get to. The fat that's around our organs, in the case of the abdominal fatty tissue, that visceral fatty tissue, that fatty tissue protects our organs to a degree, but that can be excess, and that's very diet-dependent fatty tissue. So when you come in to see us for consultation, if you have that situation, we'll examine you. We normally examine you by pinching your tissue. We pinch your skin and your fatty tissue when we assess the thickness of that tissue in that area. That thickness tells me what the thickness or quantity of fatty tissue that there is right underneath the skin. The area that we can't pinch, again, back to the area of the abdominal, in the abdomen, where somebody may have a bow to the front of their abdomen because their belly pooches out, that fat may be something we can pinch, or it may be something behind those muscles that we can't get to. And we won't be able to help a patient in that circumstance unless they do some things to help themselves first. And that would be losing weight in that internal visceral fatty tissue. It's very important for patients to try and lose that tissue also because of health reasons, right, Stacy?
Yes, absolutely.
That fatty tissue increases our risk for things like diabetes and heart disease and stroke. And so if we can lose that visceral fatty tissue ourselves, it's going to be healthier for us in the long run. That being said, most of the time patients come in and see us, we can help them a bunch with liposuction and removing extra fatty tissue from those unwanted spots. And in men and women, we're a little bit different. Us men, we tend to carry fatty tissue in kind of hormonally testosterone-driven areas around our belly and in our flank and waistline area. Women tend to carry excess fatty tissue in estrogen hormonally sensitive areas. Areas like our outer thigh, our inner thigh, and our axillary armpit breast area. So those areas are estrogen driven, belly flanks more testosterone driven. Now, we both can have either of those hormones in our system at all times, and we do typically, our hormones maintain a balance between those, and our bodies regulate that. Abnormal regulation may make things different for one person in one case or another, as in when a woman goes through menopause, their hormones change, and a woman may see that she starts to develop fatty tissue in the flank or waistline area that she never had before, and that can be very frustrating. Also, internal visceral fat can develop at that time. Same thing for a man. If a man's hormones get out of balance and he gets more heavy on the estrogen side, a man might develop breast fatty tissue and get gynecomastia, which is a surgery we talk about in another video. And that breast tissue may need to be removed through surgical means. Liposuction is fantastic at removing isolated areas of fatty tissue. And there's a few different types of liposuction. Again, the method that I use is with cannular tubes, and it's strictly suctioned out. There's a couple of other ways of liposuction that I think are important for you to know about, at least in brief. That is ultrasonic assisted liposuction and laser assisted liposuction. You may have heard of some of these, or even heard of some companies that advertise for these different types of liposuction. Be careful what you hear in an advertisement. Research things very well. Read and study and inform yourself all you can. Come in and talk to a plastic surgeon, because I'm going to give you all the information that is accurate and important. I want you to have knowledge, and I want you to make good decisions. Whatever the decision you decide on at the end is, I want to be a good physician and help you to make the best decision for you. So be careful what you read and what you hear and what advertisements you hear, because it may not always be completely accurate information. And in the case of laser-assisted liposuction and ultrasonic-assisted liposuction, they often advertise that it's a less invasive way of liposuction. Nothing could be further from the truth than that. In fact, it's the exact opposite. It's a much, much more invasive way of doing liposuction and has many more potential complications and risks associated with it. And so come in, ask us, talk to us about it, and we'll give you that information. With lasers, obviously, they're using a laser cannula before they suck out the fat to melt the fat that's in your body while it's in there. This is not done from the outside. This is done by putting a laser inside of your body and melting that fatty tissue. In addition to fatty tissue, lasers will melt blood vessels and nerves, your skin, or your underlying organs. And a surgeon not knowing how to do this surgery, and sadly liposuction is the most often one we see this in, where people who are not plastic surgeons are performing procedures. Even people who aren't surgeons are performing these surgical procedures. And frankly, sadly enough, in the state of California, even dentists have been allowed by the Assembly of California to do surgical procedures that are cosmetic related on patients. When you get a license in the state of California, you are called a physician and surgeon, even though you may have never had a day of surgical training in your life. So vet this out. Make sure you've thoroughly researched it. Talk to people who you know are plastic surgeons who've gone through that training, so you can get accurate information regarding this. Ultrasounds, similarly, ultrasounds send out an ultrasonic wave which cavitates the tissue, which means to involute it on itself or crush it on itself. The tissue shrinks down and crushes on itself, and that can happen whether it be muscle, blood vessels, nerves, skin, or fatty tissue. So people who use those instruments should be specially trained with those instruments, as plastic surgeons are. And additionally, because of the additional energy that's put into the tissue during those procedures, you're going to have more energy into the tissues, therefore more inflammation, more scar, more potential damage. So all of those are important features to know. I prefer traditional liposuction because it is more controlled. it has less chance of some of those complications. That doesn't mean you won't find a plastic surgeon who's extremely skilled at using a laser liposuction machine. You might. I was actually trained on ultrasonic liposuction machines as well when I did my training, and on laser machines. So I know how to use them all. I just prefer the traditional kind. That doesn't mean it's the only kind that works. They all three work, but there's differences that are important for you to know that may affect you post-op. And so those are things to research and really learn for yourself as much as possible. The other thing to mention about liposuction is not a weight loss technique. And while a person may lose some weight with liposuction, somebody who comes in who's very overweight, it's not a way for me to help you lose weight. I just can't accomplish that for you. I can remove fat from isolated areas, from particular spots. I can shape and mold and contour and sculpture somebody's waistline or body or hip, but I can't just remove fat from everywhere. So there's limitations on what can be achieved, limitations on how much fat can be removed, and we follow those guidelines very carefully because it's your safety that we have in mind when we're doing these surgeries. We're gonna make sure we follow the guidelines so that we keep you as safe as possible and deliver the best result for you as possible. The other part of lipostructure it's important to discuss is other part of liposuction that's important to discuss is lipostructure. Lipostructure is now taking that fatty tissue that we've removed and putting it back into a different area. So not just sculpting by removing, but sculpting by replacing in other areas. This can be done in the buttocks, it can be done in the face, it can be done in the breast, and other areas of the body. I've even done this in traumatic situations. I've had patients who've been struck by automobiles and the automobile has hit them in the leg, taken out a big section of fatty tissue from their thigh, and I've been able to take fatty tissue from the other thigh and from their tummy and from their flank and put it back in those thighs to make both of their thighs look the same again. So lipostructure is a powerful tool. Liposuction is a powerful tool in being able to really sculpt and shape a person's body. Liposuction is also an awesome surgery because unlike many of the surgeries we do, there's not many complications and there's not many downsides or much downtime with liposuction. What I really mean by that is after surgery, we place you in a surgical garment. Any one area that we liposuction may take us about an hour to do. You stay with us an hour after surgery, we put you in a compression garment, we send you home, and I give you almost no restrictions at that point. You can go take care of your kids. Once you've recovered from anesthesia, you can drive a car. You can go on a run the next day if you feel like it. Whatever you feel up to, you can do. And frankly, the more you do, the better you're going to feel. The more you move after, the better you're going to feel. It's going to take a while to fully heal from liposuction, and it may be very sore or numb or tingly, or you may have burny sensations in the skin after liposuction. Those are all normal, and some of those can take several weeks to completely go away. So plan on that, but it shouldn't keep you down. It shouldn't keep you from going back to work, and it shouldn't cause any other problems for you or give you any other kinds of restrictions. Additionally, complications with liposuction and lipostructure that are important to talk about typically are contour irregularities. That's the big one. And contour irregularities are kind of a big catch-all term that means things don't look smooth. They cannot look smooth because your fatty tissue isn't smooth, because scar is present, because your skin isn't smooth, or you have skin excess issues. Most of these I'll talk with you about specifically to you during your consultation visit with us. And if I see something that I think is going to be problematic for you, I'll explain that to you and give you choices. Some patients may say, hey, I have extra fatty tissue in my hip and I want it removed. And I may tell you in your situation, well, you've got a little extra skin in that area, so if we do this, you may have a little bit of warbliness. I may not be able to get it smooth. Some patients might say, okay, no, I don't want to do that. Then other patients might say, I don't care about that. I just want to make sure I look good in my pants. And I remember a patient saying that to me one day. She said, Scott, I'm 67 years old. I don't wear a bikini anymore. I just want to make sure my stretch pants fit me nicely. So if you can tell me that'll work, then I want to do it. So all of these different situations can be tailored to your desires, your needs, and your body. When in the case we're doing lipostructure and placing fatty tissue back in a certain area, we may need to do additional things to be very careful about that area, treat that area differently. Let's take the buttocks for an example. When we place fatty tissue that we've harvested, let's say from your tummy and your waistline into your buttocks, we're going to give you additional instructions of not sitting on your butt for the first week. Yes, you heard that correctly. Not sitting on your butt for the first week. That's a hard one to do. I tell you not to sit on your butt if not necessary for the second week. So you can sit on your bottom that second week to do things like go to the bathroom, eat your dinner, or go in a car somewhere that you have to go, but try to avoid it as much as possible. And the third week, you can sit on your bottom, but you need to be careful. In other words, no shucking and jiving while you're sitting on your booty that third week, because if you move around on it, that can create shear forces inside our bodies, and that can cause some of that fatty tissue we put in there to be dislodged and cause some of that fatty tissue to go away that we wanted to stay there. After 3 weeks, you should be able to resume any exercises. In the case of lipostructure, whether we place it in your breasts or in your buttocks or in your face, without any complications or problems with that fatty tissue. It should have a home there by then, should live in that new place. No, it doesn't go anywhere else. So people ask me that question all the time. If you put fat here, can it travel to a different spot? And the answer is no. What happens is two main processes. That fat is nourished initially by a process called plasma imbibition, which means it drinks nutrients from the surrounding cells you put it near. And secondly, neovascularization, where blood vessels grow into that new fatty tissue. You develop an entire architecture and supportive structure around that fatty tissue. Once that occurs, it's yours forever in that spot. Unless you go lose a bunch of weight, then it will go away. And then when you gain a bunch of weight, it will all come back again. It'll become normal fat just like you have in the rest of that area. You wear a compression garment after surgery for 4 weeks, and after that you're good to go. That's lipostructure and liposuction. Anything else to add, Stace?
I think you covered it.
Alrighty.